Quiet on set.
Hello and welcome. I'm Kristen Dehart, the Chief Executive Officer here at Excelsior Springs Hospital.
And I'm Kent Powell, Chair of the Excelsior Springs Healthcare Foundation. And we want to welcome you here for a night at the hospital. Thank you for participating to make this year's annual fundraiser a success.
Proceeds from tonight's events will go towards the purchase of specialized medical equipment to be used in our hospital. There are lots of fun ways to donate tonight, while possibly scoring big at the end of the evening. We've got some really great things planned for tonight.
That's right, Kristen. Tonight's event will feature some of the community's partnerships that the hospital's been working on. We also have many chances for you to win some great prizes throughout the evening.
Great prizes indeed. We're going to be drawing raffle tickets throughout the night, so be sure to listen for your name to be called. There will be 10 chances to win $50, 10 chances to win $100, and one lucky participant will win $1,000 by the end of the night.
Sounds to me like tonight is going to be a good night for all.
You bet, and that's not all. We've got a really great silent auction taking place online right now. Bids will continue through the program up to 8:30 this evening. We've got some great items on our auction that you're going to want to win. Trolley wine tour tickets, gorgeous handmade quilts and throws, gift baskets, amazing artwork, wine dinners, sports memorabilia, and
don't forget about the signed Patrick Mahomes jersey.
Yes, we're so lucky to have a signed autographed Patrick Mahomes jersey and an Andy Reid autographed football helmet this evening. The generosity of our donors this year have been so amazing. We're humbled and we appreciate all of our sponsors and our donors this year. They are the reason that we're here tonight, and it's going to be grand. If you haven't had a chance to check the auction site yet, you have until 8:30 to go get in on the fun. The auction site is easiest found by going to our Excelsior Springs Hospital website at www.eshospital.org/night@ESH/.
Tonight's program is being brought to you by the Excelsior Springs Healthcare Foundation. The mission of the Healthcare Foundation is to provide grants and raise money to help support the operations of the Excelsior Springs City Hospital. Since 1991, the foundation has been working to benefit the health services being offered and help maintain and advance the quality of level of care of our hospital provides. All donors of $2,500 and above are recognized in our Hall of Honor, located in the hospital's lobby. Representing the Excelsior Springs Healthcare Foundation, I extend our appreciation and gratitude to all that have and will donate tonight for your generosity and support of our mission.
Thank you, Dr. Powell. The Healthcare Foundation has contributed over $2 million since its founding. That's an incredible show of support for our hospital, and we wouldn't be the same without it. We are 117 years strong this year at the hospital, and even during our trying times, we're continuing to move forward with the goals of the hospital. We're expanding community partnerships in new ways to help bring healthcare services closer to our residents. You'll get a look at some of these tonight during our program, but first, we want to share a word from one of our sponsors.
Thank you for attending tonight's event. As an active community partner, Pro Electric is excited to celebrate the amazing dedication of these frontline workers. With over 44 years serving electrical customers in the Kansas City Metro, we understand the importance of building relationships and helping those in need. Much like community health care continues to change, we are also continuing to improve how we serve our customers. This year, we will begin to provide residential electric service in addition to the commercial service and construction we already perform. We are honored to be a sponsor of tonight's event and look forward to continuing to serve our customers in the Excelsior Springs Hospital community in the future.
Each year, the foundation recognizes members of our hospital staff by presenting Commitment to Caring Awards. The Commitment to Caring Award was established by the foundation to recognize not only staff, but community members also for their commitment to provide the highest quality of care for our community. This year, we had many wonderful nominees. Let's take a look at those who were nominated.
The Excelsior Springs Healthcare Foundation Commitment to Caring Award nominations for 2021. April Mackey, Nursing. April is a joy. She is a dedicated employee who is flexible with assignments and no matter what is a positive influence for the day. She has precepted new employees and provides a comprehensive orientation. She also ensures that new employees feel supported and celebrated after orientation is over. She is a part of the Rise to Shine committee and her ideas are infectious. Colleen Jackson, cardiopulmonary. When I hear the term commitment, the first person that comes to mind is Colleen. Colleen has been committed to ESH and her patients for 27 years. She is flexible to always help her coworkers, often adjusting her schedule to accommodate others to make sure the hospital needs are met. She is consistently praised for always being willing to help in any situation and has been a calm presence during so many stressful situations. Colleen is a true rock star. Courtney Jones, radiology. Courtney has been the very best advocate for our mammography community. She has excelled in follow-up care and standards like never before. She has taken the lead in the field and has walked away with 2 zero-deficiency inspections. This is a major accomplishment for any technologist, especially a new one to the field. Courtney demonstrates compassion and kindness daily with every interaction. Every woman is in great hands with Courtney taking care of them. Felicia Summers, Home Health and Hospice. Felicia started out working for us as an aide on a PRN basis while also working at the Convalescence Center full-time. Since then, Felicia has joined the Home Health and Hospice team as our administrative assistant and has done a fabulous job. She can always be counted on to support the staff and our patients. She is flexible and accountable 100% of the time. She always has the best interest of our patients, staff, and organization in mind with everything she does. I cannot think of a more deserving person. Holly McMillan, Nursing Services. Holly's peers rave about the exceptional care she delivers to our patients. One noted, "I never worry when Holly is here." Even on the busiest days, she takes the time to get to know each patient and meets everyone's needs. She is often found going above and beyond to individualize the care for her patients. Holly takes great pride in her work, and it shows in her daily performance. Janet Newell, Environmental Services. Janet has been with the hospital since 2011. Janet has displayed a consistent commitment to the hospital staff, visitors, and patients over the years. She is always willing to come in and work extra shifts when needed. She always has a smile and a kind attitude, even through her mask. Janet has received so many positive comments about how pleasant she is to staff and patients when cleaning in their spaces. I am truly inspired by her commitment to ESH. Maria Abernathy, Excelsior Springs Primary Care Clinics. Maria serves as Dr. Bazard's medical assistant and has worked with him for 22 years. She has been instrumental in the long-term success of both Dr. Bazard's practice and the recent transition and integration of the practices. Maria is a natural-born leader, frequently sought out by her peers and the practice providers for assistance. She frequently stays late to make sure that all patients are cared for and that her coworkers are assisted. Maria is truly appreciated. Nicole Shields, Nursing Services. Nicole is an amazing nurse and supervisor. She is always willing to help when needed and keeps the emergency department and med-surg unit organized and under control at even the busiest of times. She goes above and beyond what is expected of a nursing supervisor. In all of my years of working in a medical field, I have never seen such a hard worker, driven for success for her team and the organization. I am grateful for her experience and assistance to all employees. Patricia Davis, Express Clinic. Tish has distinguished herself during the last year by providing excellent care during the global pandemic. Tish covers the Excelsior Springs Express Clinic location and often sees over 100 patients per week. She handles the stress admirably and motivates her team at Express daily to remain focused on providing excellent care for our community. She is dedicated and works with the local emergency departments to be sure that timely and accurate care is provided to our acute patients. Job well done. Samantha Henson, Radiology. Samantha is highly skilled, extremely knowledgeable, and a compassionate team player. She consistently displays and promotes the highest ethical standards. She is a positive role model and continually advances her own personal knowledge. She mentors her coworkers and new ultrasound students in achieving their professional goals and development.
Earlier this week, we were happy to award tonight's winners. We had such a great time with a lot of pop-up fun events. Let's take a look at some of those fun moments tonight now.
Yeah. I'm Kent Powell, President of the Healthcare Foundation and Board of Directors, and on behalf of the Board of Directors, we'd like to present you with our Commitment to Caring Award for this year.
I don't even know what to say.
If you haven't met Colleen Jackson, it's my honor to introduce you to Colleen. Colleen has been a rock star here at Excelsior Springs Hospital since 1994.
Yep.
For the entire 27 years, 5 months, and 30 days that she has been employed at the time of this writing, she has been reliable, committed to our patients and our hospital. In her time of service, Colleen has arrived on time and will not leave until the last patient is cared for. She spent most of her 27 years taking call at night after working her 12-hour shift.
Thank God that's over.
Colleen is also one of 2 respiratory therapists in the cardiopulmonary department that can complete all of the modalities that the department offers. From PFTs, stress tests, scanning a Holter monitor, Colleen is your therapist. Colleen is also our go-to for many in the hospital because of her experience. She's an excellent educator, communicator, and knowledgeable in so many areas. She's a calm presence during many stressful situations. You can always find her helping in other departments, whether it's helping transfer patients to X-ray or passing food trays to her patients. She's a true team player, a rock star, and we're always happy to see her here. Colleen, because of your commitment to our patients, our employees, and dedication to improving the outcome related to the health of our community, we are so proud to honor you this year. Thank you so much.
Well, thank you for the very kind words.
You're welcome. And thank you, Colleen, for your service.
I'm Kent Powell, and I'm President of the Healthcare Foundation at the hospital. And on behalf of the board of the Healthcare Foundation, I want to present you with our Commitment to Caring Award for this year.
If you haven't had an opportunity to meet Courtney Jones, you're missing out. She is amazing. Courtney excels as a radiology technician in our hospital's radiology department and has been a shining star for our organization for 7 years. Courtney has been the very best advocate for our mammography community. She's excelled in follow-up care and standards like never before. She has taken the lead in the field and has now completed 2 zero-deficiency inspections. This is a major accomplishment for any technologist, especially a new one in her field. Courtney is well known throughout the hospital. Her smile is energizing to all, even through her mask. And she offers great enthusiasm into her work with the Rise to Shine committee. Just knowing that Courtney is in for that day makes that day a great day. Courtney demonstrates compassion and kindness daily with every patient and every employee. She's dedicated to her work, ensuring every patient is well cared for, comfortable in even the most uncomfortable testing situations, and a phenomenal community advocate for women's health. Courtney, because of your commitment to our patients, our employees, and dedication to improving the outcomes related to the health of our community, we are so proud to honor you this year.
Thank you.
Thank you so much. Dr. Powell, would you like to do the honors?
Holly, I'm Kent Powell. I'm president of the Healthcare Foundation Board. And we would like to present you with one of our Commitment to Caring Awards for this year.
Thank you.
You were nominated and then selected by committee for all your good work.
It's my honor to introduce you to Holly McMillan. Holly has worked as a nurse tech providing exemplary care for the past 6 years at Excelsior Springs Hospital. Holly's peers rave about the exceptional care that she delivers to all of our patients, and one noted, "I never have to worry when Holly's here." Even on our busiest day, she takes the time to get to know each patient and meets everyone's needs. She's often found going above and beyond to individualize the care for her patients, including painting their nails, styling their hair, and sharing good stories with her folks. Holly takes great pride in her work, and it shows in her daily performance. She's a great resource to our nursing staff and well respected by those that she works with. She displays passion and dedication to every patient. She has a phenomenal ability to connect with her patients and families, and her name frequently is shared when patients and family members talk about the exceptional care they received. We're incredibly fortunate to have Holly here with us, and we look forward to working with her for many years to come. Holly, because of your commitment to our patients, our employees, and dedication to improving the outcome of the health of our community, we're so proud to honor you this year. Thank you. Congratulations.
And I'm Kent Powell. I'm president of the Healthcare Foundation Board of Directors. And on behalf of the Board of Directors, I'd like to present you our Commitment to Caring Award for this year.
I'm pleased to introduce you to Janet. Janet's worked in our Environmental Services Department since 2011. Janet's displayed a consistency of commitment to our hospital staff, our visitors, and patients through those 10 years. Janet has always been willing to come in and work extra shifts when called upon. She has a smile and a kind attitude that can be felt even through that mask. Her directors have personally received many comments and compliments over the years about how pleasant Janet is to her staff and her patients when cleaning in their spaces. Recently, Janet was selected to fill a need to be assigned on our off-site facilities, leaving her hospital shifts to be filled. And the department she left were disappointed when they didn't get to see her smiling face every day. One nurse even shared, "Janet's a consistent part of our daily life, and the team really miss seeing you every day." Janet's commitment to keeping our hospital sanitized and safe for our patients comes through every day. The consistency and commitment to showing up year in and year out with a smile and a caring attention to detail in your work makes Janet our steady Eddie for our patients and staff. We are very inspired by your commitment, Janet. Because of your commitment to our patients, our employees, and dedication to improving the outcomes and health of our community, Janet, we are so proud and happy to honor you this year.
Thank you.
So congratulations.
Swallow fast.
Maria, congratulations.
Hey.
Today's your day. We have an award for you.
Maria, as president of the Healthcare Foundation, it's my privilege and honor to present you with the Commitment to Caring Award for this year.
If you have not met Maria Abernathy, it is my honor to introduce you to Maria. Maria serves as Dr. Bizard's medical assistant and has been his medical assistant for the past 22 years. She was a baby when she started. Has established herself as one of the practice's top medical assistants. Maria has been instrumental in the continued long-term success of both Dr. Bizard's practice through the acquisition by Excelsior Springs Hospital and transitioning and integrating the practice with Dr. Pickett's clinic when we moved over to the hospital campus in 2020. She was instrumental in ensuring the successful move onto the hospital campus, dedicating numerous hours to facilitate that the practices were organized, and operational on the very first day of caring for our patients at the new location. Maria is a natural-born leader. She is frequently sought out by her peers and the practice providers for assistance with any issues because of her reliability and proficiency with practice and clinical operations. She's a team player and goes above and beyond to ensure that all of her patients receive optimal care and are completely satisfied with each encounter. Maria frequently stays late to make sure the practice's patients are cared for and is often assisting her coworkers in any area that they may need for assistance. Maria is truly deserving of this recognition and award. Maria, because of your commitment to our patients, our employees, and dedication to improving the outcomes related to the health of our community, we are so proud to honor you this year. Congratulations. This is our North Kansas City Hospital pharmacy team here at Excelsior Springs Hospital, and we are here to award you with...
I'm Kent Powell. I'm president of the Healthcare Foundation Board of Directors, and we'd like to present to North Kansas City Hospital Pharmacy our Commitment to Caring Award this year. And we appreciate that. Thank you.
And of course, we have just a few little things that folks have said about you guys, so I hope you don't mind if I read this to you all. To our North Kansas City Hospital pharmacy team, it is my honor to introduce you all, if you don't know this great group of individuals, who are well known in our hospital. During talks in early 2019, we were introduced to Denny Fugate and David Hitchcock. These gentlemen shared a vision and commitment for our hospital with a thought to not only add pharmacy services at the hospital, but add coverage for our employees. And then this really lofty goal was to open a community pharmacy. And all parts of this vision have been realized over the past 2 years, and we are beyond impressed. 2021 continued to be an interesting year for us all. As the COVID-19 pandemic continued, we found ourselves to be in a great position to help our community. With the help of North Kansas City Hospital and their pharmacy team, their phenomenal pharmacy team members, we delivered over 3,000 COVID vaccines to our community members in Lawson and Excelsior Springs. Added to that, we put in flu vaccines for our staff, our school district, and our community members. Coming soon, because of this wonderful team, we're also able to offer booster doses. And while COVID sometimes seems to be here to stay, we're here to knock it out. Lastly, with the recent announcement of the Monroe Pharmacy closures, our pharmacy team didn't miss a beat to say these communities need our help. They worked so hard with prescription transfers starting the very, very next day, and have worked countless hours to continue the process to make this smooth for all of us. For a community hospital, guys, we sometimes have very lofty goals, and I know sometimes I ask, are we asking you guys to do too much? Are we pushing you too hard to think outside the box? And a resounding answer always from David, Jana, Nancy, Lauren, Rose, Gail, Gabby, and Mindy, and all the extra support that we get from North Kansas City Hospital. You guys keep saying, keep it coming, and we thank you for that. And so for that, Team Pharmacy, because of your commitment to our patients, employees, dedication to our outcomes related to the health of our community, we are so proud to honor you this year, and thank you so very, very much. How great is that? Thank you to all of our Commitment to Caring Award winners for always going above and beyond to offer such great health care to our community here.
In addition to the Commitment to Caring Awards, we also take this time to recognize those who are considered up and coming. These awards are meant to recognize those who may be newer face in the organization, but are already proving their commitment to the cause. Let's take a look at this year's nominees.
The Excelsior Springs Healthcare Foundation Up and Coming Award nominations for 2021. Brandon McWilliams, Health Information Management. Since day one, Brandon has been a team player. No matter the task, he accepts with a smile and accomplishes it. Not only is he in constant communication to make sure charts are up to date, he also always tries to find ways to make our crazy processes better. We are very fortunate to have him on our ESH team. Brianna Deal, Emergency Department. Brianna is a go-to person for all things related to the registration and unit clerk role in the emergency room. She is open to change and provides open and honest feedback as well as solutions when processes are not working. Brianna assisted in precepting new teammates and is an excellent instructor. I can't say enough positive things about this young lady. Brianna Tucker, Radiology. Brianna has excelled in our surgery and pain clinic roles. She has single-handedly done almost every procedure with the new doctor since her arrival. She is the kindest and most gentle soul to our patients. She is someone who excels in patient care and teamwork. She will be an asset to our hospital for years to come. Chance Storm, Human Resources. Chance has been instrumental in completing the implementation of Paycom and has been involved in multiple HR initiatives that have provided improved processes and efficiencies in the department. Chance has also taken on the added duties of recruitment and a new employee orientation. He provides a wonderful first and lasting impression for all of our staff. Dr. Dennison Hamilton, Interventional Pain. Dr. Hamilton has a passion for caring for patients in pain. He has helped countless patients since his arrival here in 2020. He brings with him not only the standard epidural steroid injection treatments, but new and exciting technologies and treatment options to help those in pain. His practice continues to grow as word spreads about his care. Jean Ann Thompson, a COVID screening with Medical Surgical. Jean Ann has been a welcome addition to our ESH family. She has been flexible with her work, hours, location, and has worked extra to support the screening needs and has even taken on administrative work to help ensure we have successful COVID vaccine clinics in the community. I never worry when she's working and always look forward to seeing her. Joyce Teagarden, Outpatient Clinic. Joyce consistently demonstrates a can-do approach to patient care. There have been numerous changes in the outpatient department this year, and Joyce has adapted and participated as a change agent. Joyce is incredibly helpful and is always candid with feedback. This is so fantastic because it helps to better understand how we can support our teams. Nancy Jones in Laboratory. Change is difficult, without a doubt, and Nancy has accepted the daily challenges and changes in the department without hesitation. Her continual support as we move forward implementing new processes, methods, and instrumentation has been unwavering and is appreciated. Nancy never hesitates to assist anyone in need and always has a positive attitude and a smile on her face. Rochelle Dotson, Patient Access. Shelley is such a positive and outgoing person. She would drop anything to help anyone and always does so with a smile. Shelley has joined the Rise to Shine committee to share her caring and compassionate side with coworkers and employees. She is always a great resource and is a best mom to many here at ESH.
And now we're happy to announce this year's winners. So if you have not had an opportunity to meet Dr. Powell, I'd like to introduce you to Dr. Kent Powell.
Hi, Kent Powell, President of the Healthcare Foundation Board of Directors, and on behalf of the Board of Directors, I'd like to present you with our up-and-coming award for this year.
Thank you. And we want to share a few things that your coworkers had to say about you. It's all very good, I promise. If you have not had it is my honor to introduce you to Brianna Deal. Brianna serves as a unit clerk in the emergency department. Brianna is the go-to person for anything related to the registration and unit clerk role in the emergency department. She is open to change and provides open and honest feedback as well as solutions when processes are not working or hindering the department, staff, or patient flow. Brianna assisted in the precepting of new teammates and has received numerous compliments about how thorough and patient she is when teaching. She continually goes above and beyond to ensure that her teammates are successful. The nurses and physicians continuously rave about Bree, noting, "When I see her in the morning, I know that the day is going to be great and it'll flow smoothly." She is currently retyping and updating all of our forms that were illegible or repeatedly copied and worn. I can't say enough positive things about this young lady.
Oh, thanks.
So, Bree, Shelly Dawson, today's your day. How are you?
Shelley, as president of the Healthcare Foundation Board of Directors, I would like to present to you the Up and Coming Award for this year for all your dedication and hard work to this hospital. So.
If you haven't met Shelly Dotson yet, it is my honor to introduce you to Shelly. Shelly serves as a patient access clerk in our patient access department. Shelly is such a positive and outgoing person. She would drop everything to help anyone and does so with a smile. Since starting with Excelsior Springs Hospital, Shelly has shared her caring and compassionate side with so many coworkers and employees. She's also done so much with the Rise to Shine committee to share those qualities with others and help recognize and thank others in our hospital. Shelly is a go-to person for numerous employees and has been a huge help training other staff members. Even as she was transitioning into her new role, she was willing to help find resources needed for those around her. She is the mom to many of us at Excelsior Springs. Shelly deserves this award and much more for always being willing to help however she can as she empowers others to do the same. I know she is and will continue to do amazing things for our organization. Shelly, because of your enthusiasm and willingness to go above and beyond, we are so pleased to honor you this year.
Thank you so much.
Congratulations.
Nancy, I'm Kent Powell. I'm president of the Health Care Foundation Board of Directors. And on behalf of the Board of Directors, I'd like to present you our Up and Coming Award for this year. So we have a Commitment to Caring Award every year. And those are people who've been here over 5 years and people who've been here less than 5 years who have been exemplary in their service to the hospital and nominated by a fellow employee gets the Up and Coming Award.
Well, that's wonderful.
And if you guys don't know Nancy Jones, it's my honor to introduce you to Nancy. Nancy's worked as our laboratory lead for the past 2.5 years. And in June of 2021, Nancy was tasked with an unexpected position of taking on more leadership responsibilities within her department. Change is difficult, without a doubt, and Nancy has accepted the daily challenges and changes in the department without any hesitation. Her continual support as we move forward implementing new processes, methods, and instrumentation have been unwavering and very much appreciated. Through her excellent care practices, Nancy created positive patient outcomes by nurturing our less experienced staff, helping instill confidence by improving their technical abilities. She shares her many years of experience with the knowledge and with the staff. Nancy is an amazing support to our lab team. She never hesitates to assist anyone in need and is never without a positive attitude. I enjoy working with her and appreciate her continued commitment. So Nancy, because of your enthusiasm and willingness to go above and beyond all the time, we are pleased to honor you this year. Make sure you put this in your pocket. That's a $100 gift card for you.
Wow.
And if your lab people are lucky, you might buy them lunch or something.
Yeah.
New this year is the Director of the Year Award that will be given to a department director for their work in going above and beyond the care of our community. Here are our nominees.
Excelsior Springs Healthcare Foundation Director of the Year nominations for 2021. Angela Ochoa, Infection Prevention and Employee Health. Angela did incredible work to organize and run the vaccination clinics that Excelsior Springs Hospital held. She kept things organized and vaccines available and never missed a reporting deadline to the state. Angela also provided fit testing for the entire organization twice during the pandemic to make sure that each person had the right PPE available. Angela is a team player and strives to always do the right thing. We are so lucky to have her on our team. Deanne Schoenfield, Revenue Cycle. Deanne hit the floor running when she took over HIM and stepped into working with the business office. Recently, Deanne has led the charge as a crucial member of the drive-through COVID testing team, making sure that testing, processes, and results are efficient and that volunteers are valued and recognized for the work that they have done. She always has a sunny attitude and is very infectious. She is what Excelsior Springs Hospital strives to be, committed to caring for our community. Erica Eckersley, Cardiopulmonary. Erica gives her time selflessly. Because of her clinical expertise and commitment to the hospital, she often is asked for advice and assistance. She spends countless hours helping her team as well as every other department in the organization. Many projects would be delayed if it were not for her commitment, knowledge, persistence, and dedication. Our team is stronger and more competent because of Erica. Our patients, staff, and surrounding hospitals all agree. We have a gold star leader here. Jennifer Pantleo, Patient Access. Since the day that I started at ESH, Jenny has been an excellent leader and resource for me. She truly cares about the employees she hires and wants them to succeed. She also is very devoted to her job, spending many hours in the new COVID drive-thru, as well as continuing to support the staff while in training. Jenny is a great representative of Excelsior Springs Hospital. Keith Van Beber, Outpatient Services. Keith runs the outpatient department with efficiency and grace. Keith is a leader in our organization while serving alongside the outpatient staff when the need arises. Keith is willing to take on projects outside of his department as demonstrated by the MCN Policy Project. Keith raises insightful questions and never hesitates to consider all angles of a request before determining the best course of action. Keith is amazing. Lisa Fielder, Medical, Surgical, and Emergency Department. Lisa has shown an incredible dedication to her team, excellent patient care, and leadership during the pandemic. She has supported all teams through the unforeseeable influxes of patients with higher acuity needs than what this hospital has historically experienced. Her leadership helped the organization to adapt and navigate through the challenges that were presented. Through it all, Lisa has embraced our service values and our mantra to empower, strength, and hope. Tanya Deason, Radiology. When I think of someone who is committed to caring for the good of the hospital and patients, it's Tanya. Tanya is always researching ways to better ourselves, our facility, and workflows. She is a get it done and find a way kind of person. Tanya is always willing to step up and take on additional roles to help better ESH. Her most recent is with Cheers to Peers for the organization and helping to develop an awesome employee recognition program.
As the hospital CEO for Excelsior Springs Hospital, I can tell you that every single one of our directors deserves this award this year. I'm super proud of all of our team, but want to announce the winners are
I have a couple of awards today, and these are very special awards because they are for Director of the Year. And we had two people that were just so outstanding that we couldn't decide, so we gave one to each of them. So we have co-Directors of the Year. And so first of all, Erica Eckersley.
We've talked plenty about, I'm not going to get through this. We've talked plenty about heroes in healthcare over the past several years, but there's a critical healthcare practitioner who deserves a ton of recognition, especially during this pandemic that just doesn't seem to end. It's my honor to introduce you all to Erica Eckersley. Erica joined Excelsior Springs Hospital in 1997, fresh out of school and excited to help people. Imagine how many people her commitment, time, and dedication have helped over the 24 years of her service as a respiratory therapist and director of cardiopulmonary services. Erica is well known throughout this organization, treating patients in the inpatient and emergency room setting, outpatient with pulmonary function testing, setting patients up with CPAPs and BiPAPs, and adding ventilators to her experience this year. Erica recognized early in this pandemic that the respiratory needs were increasing and quickly added staffing levels to accommodate 24/7 coverage. She jumped right in when 5 new ventilators arrived on a Friday night at 11 o'clock, 11:22 p.m. In addition to the high demands that COVID has added to this respiratory team, Erica's commitment to her patient care has included tagging along on ambulance rides during patient transfers to the other metro hospitals, making sure our patients are cared for under her watch. The team, both here and at the receiving end, have shared their appreciation countless times. The Pink Ribbon Fund, while a passion of Erica's and our hospital, really allows her competitive nature to shine. The intent is always focused on fundraising for this critical and highly inspirational cause, and it's truly a joy to learn that year after year we seem to always sell a few more shirts than the fire department. That was a secret. Erica, we appreciate you and your leadership so much every day. We're glad that you chose to work at ESH, and especially that you came back day after day. You truly are a hero, and we want to thank you for your commitment. Because of your commitment to our patients, employees, and dedication in improving the health of our hospital and our community, we're so proud to honor you this year, Erica. Thank you. Thank you.
All right, one more award, also for Director of the Year, Deanne Schoenfield.
And it's my honor to introduce you to Deanne Schoenfield. Deanne joined our Excelsior Springs Hospital during 2020 in a contracted role and quickly became a highly respected member of our family. Over the time span of the past 2 years, Deanne has provided countless hours of service in our departments and through her work on our community health initiatives. Deanne hit the floor running when she took over health information management and stepped into working with the business office. Her support during the transition into revenue cycle was and is invaluable. Deanne not only has taken on the role of learning our unique hospital processes, but has taken these processes and continued to better define and clarify, working with the departments to document as they find ways to improve. Her work in our revenue cycle has reduced the number of AR days, which in turn has brought cash and payments into the hospital through collections, which makes that guy really, really happy. Deanne always has a sunny attitude and is so infectious. She's often working late into the night and through weekends. She's a crucial member of our incident command team and continues to be instrumental in making sure the drive-through COVID testing continues to run smoothly. Her daily updates are so uplifting, and her thank you notes are appreciated. She's an amazing addition to our team and the ESH family, and very deserving of this recognition. Deanne, we can't imagine our life without you, and appreciate your commitment to excellence this year. Your commitment extends to every department in this organization, all of whom are applauding your efforts today. Thank you, Deanne, because of your commitment to our patients, employees, and dedication for improving the health and fiscal outcomes of our hospital and community this year. We're proud to honor you. Thank you so much.
Congratulations and many thanks for all that you do to make our hospital a better place. To all of our nominees, even bigger than the prize or a trophy at the end of the race is a recognition by your peers, colleagues, and your community members. Thanks for all the care and service that you provide every single day. It's always so thrilling to celebrate our successes, isn't it, Dr. Powell?
I do, Kristen. That's why I think we should keep that momentum going by drawing our first set of raffle winners.
Well, that's what we're here for tonight. But before we do that, let's hear a word from our new Community Outreach Coordinator, Tina Cook.
So what I will be doing and have been doing is working with our Excelsior Springs Community Center to fuse or blend together the partnership with the community and the hospital. Our goal is to bring education, health and wellness resources to the community so that we can empower you to have more information at your fingertips to help with health and wellness. So fuse. Fuse means to blend or to join together to form a single entity. And so if you take that word and you use acronyms, you've got foster relationships, you've got understand the unique community needs, you've got share information, and you've got empower. And so that is my goal, and my role is to do those things through education on a variety of different topics. So part of what you have maybe already seen is our Fuse community calendar. Each month we have a Fuse calendar that presents all of the educational offerings at the Excelsior Springs Community Center on behalf of the hospital. Our goal with that is to empower you to have information at your fingertips to help with health and wellness. Both Excelsior Springs Hospital and the Excelsior Springs Community Center recognize that health is more than just physical. Health is physical, health is spiritual, health is mental. And so we look at that entire approach, we look at the holistic approach, and we are partnering together to bring you all of it, all of the components. So it's great to be working with the Excelsior Springs Community Center because there's so many wonderful activities there to help with our physical health. But we're also bringing in many educational topics to help also with our spiritual needs and with our mental health needs. And so we're really excited that we have been able to partner with people like our surgery departments here at the hospital so that we can talk about surgical offerings. People with like Tri-County Mental Health so that they can come and talk about some of the mental health offerings that our community offers. People such as our diabetic educators and our physicians that come and that will share with us all the different topics that help empower you to be preventative in your health and wellness and also to be an active role player in your overall care. I am very excited to be a part of Excelsior Springs Hospital. It is a fantastic organization that's doing so much work to have a great offering for our community, for the patients that we serve, so that you have an incredible experience when you have needs with your health and wellness. We're excited to serve you, we're excited about all of our future offerings, and we're excited to be a part of your healthcare community.
All right, team, we're ready. Get ready. We're ready to draw for our first 5 $50 winners. Dr. Powell, I'm going to let you do the honors tonight. Draw your name.
Yeah, I'll try not to draw mine. First one is Chance Storm.
Woo! In our HR department, Chance. Boo! Big winner, $50.
Second one is Renita Wilhelmy.
Renita, happy birthday tomorrow. You're a $50 winner. Yay!
Janine Stubbs.
Janine Stubbs.
Member of the Healthcare Foundation.
Awesome.
And the hospital board.
$50, Janine. Congratulations.
Misty Lawson.
Oh, Misty
Hey.
Lawson. $50, Misty. Congratulations.
And one more. Joyce Teagarden.
Woo, Joyce Teagarden. Congratulations. $50.
That's great.
What a great way to start our night, guys. We've got many more chances to win tonight, and just stay tuned.
I'm ready to see what the hospital's been up to in our community. We've had so many amazing things that have happened this year.
Yes, we have, and we're really thrilled to introduce you to our Lawson Primary Care, which moved over to its space on 6th Street this year. Take a look. What an amazing transformation. We are so excited for the footprint and all of the work being done at our Lawson Primary Care Clinic.
I think some people will be very astonished by what they see here from the old building to the new building. As most people know, in the old office we had 3 exam rooms and could only see a limited amount of people, and just going to be able to see a lot more people here and provide more services for people that we didn't have. And what we won't change even in a new building is the way we've done things in business forever and taking care of people, getting to know them personally, but just excited about this new building, this new area, and seeing people in it.
We're excited to continue the excellent health care here at Lawson Primary Care through our providers and staff that are from right here in our Lawson community.
And I can't thank our workers and our tradespeople enough. These people were put on such a tight timeline, and they are ready to go for a grand opening on June 28th. We're super excited to be open and let people come in for tours and to see our new space and our new home in Lawson.
That space looks wonderful. It's comforting to know that the hospital is providing more specialists to our rural communities so that they have the best possible care for them.
Absolutely, and if you think that space looked great in the video, you should see it now. We're so happy to have our clinics in Lawson, but don't forget our express clinic also inside the Price Chopper. We keep adding more ways for you to get your health care that you need local. Take a look at what's happening with our telehealth endeavors this year.
Welcome, my name is Patricia Davis. I'm a nurse practitioner at Excelsior Springs Hospital. We're here today to talk to you about some very exciting news. We're going to start doing some telemedicine in our area. This is going to help provide our providers and our patients with a more team-based approach to addressing all of your healthcare needs. At Excelsior Springs Hospital, our primary care providers use a comprehensive team-based approach while working towards being a partner with you in your quest to a better health. Our main goal is always looking for ways to improve healthcare standards and quality of care with each patient on an individualized basis. Through the use of telemedicine, this is going to allow our primary care providers a solution to this problem by improving quality measures and closing the gaps in our community health services. We aim to improve overall health and wellness in a way that we can monitor and address your preventative health maintenance needs, primary and tertiary care of acute and chronic diseases, through specialized monitoring, goal setting, and education. Utilizing telemedicine also allows us to eliminate patient barriers that prevent patients from seeking regular healthcare services and specialty services by bringing the specialist to you during your telemedicine visit. One of the main reasons for this expansion in telehealth service in our community is due to the decline in traditional access to primary care providers and to specialists in our rural areas. From a logistics perspective, it could take hours to travel to a visit of a provider or a specialist, and therefore fewer public transportation options are available to some patients. But this technology opens up the opportunity for patients to connect with providers on a national level. If a rural patient can't find the services they need locally, they can connect with a specialist through any device with any internet connection. They can also come to our clinic and we can hook them up to our telemedicine communicator, and we can connect to a specialist in that way. So this service is going to allow us to provide our community and all of our rural patients with the options of not just seeing a healthcare provider, but also a specialist. We look forward to seeing you and cutting off those hours in your drive. Thank you.
It's truly amazing what you can do with technology. It definitely brings it in full circle by having our doctors virtually come into our homes. Now, I'm ready for a few more winners. Let's go ahead and do another raffle. We have 5 more $50 winners to announce.
Okay, but first, I want to hear from another one of our community partners. Sarah Noblet is the director for the Good Samaritan Center, which offers services for those that are less fortunate in our community.
Hi, my name is Sarah Noblet, and I am the Executive Director of the Good Samaritan Center, and we are extremely excited to be partnering with the hospital for our clients. We have been able to experience their meals that they've provided for the Community Connect that we have done here every year. We haven't been able to do it in the last year or so due to COVID, but they've always provided wonderful meals for us. And so we are currently, right now, we do scripts through the hospital. It has cut down on a lot of costs for our clients. It's cut down on costs of transportation for our clients. And so we are looking very forward to being able to expand that with the community and with the hospital so that our clients can not only receive lower cost prescriptions, but that maybe eventually they can start to begin to see some of the doctors and the specialists at the hospital as well. Something else that we're doing is we are working with Dr. Strickland, who is an addiction specialist, and that's an extreme advantage for our clients here. A lot of our clients struggle with addictions, and as you guys probably know, this community does have some of that. And so we have been blessed by Dr. Strickland for some of our clients to be able to go over there and receive some of these services to help them get out of that rut. Thank you so much for participating in the Excelsior Springs Hospital's virtual night out. We also thank you for all the support that you have given to the Good Samaritan Center in the last couple of years. And we look forward to all the help that they're going to be doing for this community in the future.
All right, team, just a reminder, the auction closes at 8:30, so be sure that you're getting your bids in, but don't bid on what I'm bidding on.
So great to see all these wonderful partnerships happening right here in town. Now let's draw for the raffle.
Okay, finally.
Kristen, would you please do us the honor by drawing the next 5 winners?
I would love to. Margot Taylor.
Great.
I guess I'm supposed to let you read the names, aren't you?
Oh, okay. You want me to read them? Okay. Christy Marker.
Woo woo, Christy, yay!
Amy Thompson.
Awesome. Of our North Kansas City Hospital partners. They're sticking together.
Oh, Dr. Powell.
What? Yay!
That guy.
We're going to let you have it this year. He never wins anything, but he does here. He's our superstar. And?
Oh, and Dr. Craven.
Dr. Craven. All right. Congratulations,
wow, 2
all.
dentists in a row. How about that?
Whoa, didn't put that together until you just said that. Congratulations all on your $50 awards. Now I am so excited to introduce you via video to David Hancock, our pharmacy director and the mastermind for bringing our community pharmacy to Excelsior Springs Hospital.
Hi, I'm David Hitchcock. I'm the pharmacy director at Excelsior Springs Hospital. I'm excited that Excelsior and North Kansas City Hospital have now partnered for 2 years as of October 1st for providing pharmacy services. This past year, we started filling prescriptions for the community of Excelsior Springs and accept most insurance plans. Coming soon on November 1st, we'll be expanding our hours from 7:30 a.m. until 7 p.m. If you have questions about transferring your prescriptions, please give us a call at 629-3667. And thank you for joining us at A Night at the Hospital.
You're up.
Okay. Go. Oh, it's so nice to have a pharmacy on the hospital campus, making it easily accessible to the primary care physicians and outpatient clinic patients. I love seeing the convenience that the hospital is continually working to provide.
You better believe we're loving it. And while we really do love providing it, I think it's time now that I get to say, let's draw for a couple of more raffle winners. We're up to our $100 winners now. I think we should start with 3 names. Dr. Powell, what do you think?
That sounds great.
All right, let's go. We'll let you do the honors this time.
Okay.
Melinda Mahaffey with our city. Woo woo! $100, Melinda. Christy Marker again. $100, Christy. Woo woo! She's lucky tonight.
One more.
One more. And Margot Taylor.
Hey.
Margot Taylor, congratulations on your $100. You know, the hospital's been working so hard to offer a variety of services to our residents in order to provide them better conveniences in accessing health care that they need. Let's hear now from Jesse Hall, no stranger to anyone, with our Excelsior Springs Community Center.
I'm Jesse Hall, and I am lucky to be the director of the Excelsior Springs Community Center. I came on board approximately 5 years ago, and this Halloween is our 5-year anniversary, and we are sure excited about the many things that have happened here at the Community Center. One of the things that we have realized is we're only as strong as our members and our partners. And we have had some strong partnerships over the last couple of years, but we have taken on a couple of corporate partnerships recently that are sure exciting. And those are dealing with wellness. I think that everybody realizes that there are many benefits to a corporate partnership and a wellness partnership. Let me share just a little bit about the Excelsior Springs Hospital and the Excelsior Springs Community Center. About 3 years ago, Kristen and I sat down and we started discussing how we could be better together. And we have started in on those partnerships, and we finally finalized a plan that once again is just a beginning. We amended the original plan, but the one thing that I was wanting with the hospital was I wanted something that we could measure. And they have 7 of the goals of the wellness plan. One, Kristen was high on, she wanted to reduce elevated health risks. She wanted to reduce healthcare costs, decrease absenteeism, improve health behaviors, improve productivity, improve recruitment and retention, and build and sustain employee morale. And you might ask why. And the reason why is that since 2000, according to the Center for Disease and Control, since 2000, the Center for Disease said that we have raised insurance costs by 87%. Of that, we know that the chronic disease is one of the #1 reasons for absenteeism. We estimate we've eliminated these 3 risks: poor diet, inactivity, and smoking. According to the CDC, that would 80% of heart disease and stroke would decline, 80% of type 2 diabetes, and 40% of cancer. Of that, we know that for the Center for Disease and Control, we released the following on workplace obesity. The total cost of obesity for employers in the U.S. is $13 billion annually. Extra cost to employers annually due to obesity includes 1, $8 billion health insurance. 2 would be $2.4 billion in sick leave. 3, $1 billion associated with disability insurance. So what you have at the hospital and the community center is a progressive effort to make a difference not just to the wellness of the employees, but to the wellness of the members here. One of the things that Kristen wanted to do was put a person on site here. Tina Cook is our person that is the community relations. Just the other day, I'll give you a perfect example. We had a clinic and a lunch and learn on obesity. We had a young lady that came in a wheelchair, and I cannot wait to see her leave walking after she goes through the program that the hospital and the community center are working on. So those are just some of the differences. Currently, we have 5,200 members, 5,200. Through the pandemic, we dipped down to 3,900 with the partnership with the school district, which we will hopefully have approved with the City Council on Thursday. It'll take us up to around 5,500. There are many great things happening at the Excelsior Springs Community Center.
It's great seeing the hospital's mission in action, working together to bring services closer to the residents.
I agree. And just wait, there are more services that we are working to bring this way in the near future. Let's do another drawing. I say this time let's go for 4.
Sounds good.
We have a very special guest drawer tonight, Miss Mackenzie Cole.
Hey, draw out a good one, Mackenzie. Ah, Chris Weir.
Woohoo!
Jana Murphy.
Our Lawson connection, both taking it in tonight.
Ah, Tiffany Cook.
Very nice, Tiffany, yay!
Guess one more, huh? Oh, Dr. Craven again.
What,
So
Dr.
there we
Craven?
go. Thanks, Mackenzie.
Thanks, Mackenzie, you did a great job. I'm really excited to bring to you our next feature, which gives you an introduction to our new Excelsior Springs School District Superintendent, Dr. Travis Hucks. We are super excited to see all that he has to bring to our community and excited about our relationship with the school district.
Hello, I'm Dr. Travis Hucks, Superintendent of the Excelsior Springs School District. I wanted to say hello and thank you to the Excelsior Springs Hospital for the warm welcome they've given me to this district and to this community. I also want to thank them for all the partnership opportunities that they've offered to this school district, present and future. I love that we spend time together on a regular basis working on ideas to make this community and this school district better. Everything from flu clinics with regard to the pandemic to perhaps telemedicine in the future. So thank you very much and have a great evening.
It's nice knowing there are so many committed professionals here to help. We look forward to getting to know Dr. Hucks and welcome him to Excelsior Springs.
Absolutely. We are so fortunate to have so many compassionate people working in our community for sure. We're excited to hear from our next community partner, Julia Meese, who is the director of the Excelsior Springs SAFE, a grant-based program that seeks to reduce and eliminate illegal drug usage in our community's youth.
I'm Julia Meese. I'm the program director for Excelsior Springs SAFE, and SAFE stands for Substance Abuse Free Environments. And my job is to direct the Drug Free Communities grant that SAFE has had since 2016. We had the initial 5-year grant, and then we just found out actually that we have another 5 years of the grant. So the hospital has been a really key partner in this Drug Free Communities grant. Actually, for this next 5 years of the grant, we applied underneath the hospital. So my position as program director is actually an employee of the hospital now, and the hospital is just super supportive, and we're really thankful for the hospital's support in SAFE and our Drug Free Communities grant. The goal of the Drug Free Communities grant is to increase multi-sector collaboration in the community around the issue of youth substance use prevention. So that means basically we take people from all over the community and we work together to try to come up with strategies to prevent substance use among our youth in Excelsior Springs. So our key partners are the hospital, like I said, and we have the schools, the law enforcement, social service agencies like Good Samaritan Center, Chamber of Commerce. We have the Drug Free Communities has 12 different sectors that we have to have represented on our coalition. And so we come together at our monthly meetings and then events in between times to all work together and to affect the community as much as possible through education and policy change and events all centered around youth substance use prevention. So some of the things that the hospital has done to support us through this and to kind of be an active role in prevention in our community, they've really helped us to get the word out about prescription drug safety among youth and adults. And as we all know, opioid addiction is really big in the United States, and this is something that we can affect change in by focusing on youth and preventing addiction and substance use among youth. And so the hospital has really worked with us to help educate the public on prescription drug safety and awareness, and to publicize the take back days that the police department has a couple times a year where they take back excess prescription drugs to safely dispose of them and prevent diversion of the drugs. And the hospital has also really helped us to distribute the safe drug disposal packets, which are little packets that people can dump their extra prescription drugs in to dispose of them safely and environmentally friendly way. And they have helped us by distributing these in the pharmacies and through home health and hospice. And so that's been super beneficial also. Kristen DeHart is really one of our biggest advocates. She has been super awesome with just highlighting the need for prevention and also for substance abuse treatment in our community. She's done this in a lot of different ways. She's spoken at community events about prescription drug safety and substance use issues. She has really prioritized substance use issues in the community by creating programs around treatment in our area. She's brought the EPIC program to Excelsior Springs Hospital, and we're the smallest hospital by far that is involved in this program, but the goal of it is to provide treatment to those suffering from opioid use disorder. Kristen was integral in bringing this to our community, and it wouldn't have happened without her. And this is just a huge step forward for helping those with opioid use disorder to be able to live their lives up to their potential again. Kristen also has prioritized these issues through hiring an addiction certified specialist, Dr. Strickland, who is already doing great things in this area as well. One of the things we have done with SAFE is, while we are bringing all the different sectors together around prevention, it also ends up being bringing the different sectors together around treatment issues to just highlight how every member of our society here or our community here in Excelsior Springs can be a part of prevention and a part of helping those who might have a substance use disorder to get connected to treatment and to just stop the stigma around substance use disorder. So we're super thankful for these community collaborations and for all that the hospital has done for us, and we're looking forward to 5 more years of the Drug Free Communities Grant and for SAFE being a part of Excelsior Springs Hospital.
It's so great knowing these important programs are being conducted for the betterment of the entire community.
Yes. We only have 3 more raffles to draw before finding out who our big winner of the night is. And with big money draws, I think it is only fitting that Cameron Meyer, our Excelsior Springs Hospital Chief Financial Officer, comes forward to make that draw. Cameron, why don't you come on up, and while you're making your way, we're going to go ahead and see about a message from Dr. Hoffman regarding our current COVID situation.
My name is Brad Hoffman, and I'm the medical director of the emergency department. And we just want to give you a little update on our coronavirus response and some of our data. We don't have a lot of firm data, but we have seen over the last couple of weeks that our census for coronavirus has gone down. We've been very, very fortunate to have such an amazing inpatient management team. Dr. Slack and Dr. Fox and Dr. Pickett have managed a lot of our coronavirus response on the inpatient side. Their volume was extremely high a few weeks ago. Fortunately, we have seen somewhat of a waning in our admissions of coronavirus, and fortunately some of our acuity as well. They expertly managed some really sick people, some of whom I actually admitted through the emergency department. So we don't really have a lot of projection as far as what cold and flu season is going to bring. We've already seen a few flu cases. So what the coronavirus is going to do is still kind of up in the air, but we were going to now see a mix of coronavirus and influenza along with the common cold and then the standard pneumonia. So it's going to be a potpourri of various pathology, a lot of respiratory pathology. So I would simply encourage everyone to get vaccinated, get your choice of any of these vaccines. They're highly effective, they're very safe. We have information on those. If you're wanting to read that, talk with any of our professionals. Your healthcare provider would be the best place to go for that. And we have some fantastic ones. So I would really encourage you to do that. You're not just doing yourself a favor, you are doing the ethically responsible thing with that. So we thank you in advance for that. We thank you if you've already had your immunization. Our hospital is doing a great job. We're, I think, in my opinion, more than fulfilling our goal as a critical access hospital and serving the community. We have had some great outcomes. Our own little miniature parade for some of these longer term admissions out to their vehicle to go recuperate at home. So many thanks to the emergency department staff and the inpatient staff, the nurses, the respiratory therapists, the radiology technicians, all those involved all through the hospital. And I hope you have a wonderful night at the hospital, and we're going to hopefully have a wonderful day here in the emergency department. Thanks.
So we're about 15 minutes from the end of our auction, and we've got a lot of great stuff going. I'm hearing this Salvi Bowl is getting a lot of attention tonight, guys. So I'm going to turn it over to the guys for the last 3 $100 drawings. Dr. Powell, Cameron, pick some good guys.
Hey, there you go, Cameron.
Got my eyes closed. I'm going to dig deep here.
Diane Mishlik. Yay.
Oh, very
Great.
nice.
All right. Here we go.
Brenda Lewis.
Very nice. Congratulations.
One more. Deanne Schoenfeld.
Woohoo!
Fantastic.
One of our
That's great.
directors of the year. Awesome.
Yeah, that's great. Thank you,
Great job,
Cameron.
guys. Thank you, Cameron, for your help. All your work this year.
It's really amazing seeing all the wonderful people and ways in which our staff are working to reach out and heal the community.
Absolutely. We truly love what we do at Excelsior Springs Hospital. And with that being said, we should be down to our final raffle drawing of the night, but we're excited to find out that $1,000 winner, but found out we've got a couple of bonus little gifts to give away tonight. So we have three $100 McKeever gift cards that have been donated generously from our community. I am in awe tonight of the generosity that's been shown by all of our staff, our volunteers, and community members, and thank you, everybody, for all that you've done. So let's go ahead and draw these three names for these Price Chopper $100 gift cards.
Hey.
Woo, woo, woo!
Yay. You want to draw?
You want to draw?
No, you draw.
Okay, I'll draw.
Dr. Travis Hucks.
Oh my gosh, he's getting his groceries from the hospital. What?
Chance Storm.
Another second winner, Chance, getting a $100 gift card from Price Chopper.
Hey, that's great.
That is great. He'll love us. And
Community Bank of Missouri.
very nice. One of our
Right.
sponsors tonight. Very good.
Super.
Awesome. All right. I think at this time we have a special honoree in our room, a dynamic duo that is here in our room tonight. Gary and Kim Sanson are pillars in our community and are incredibly great friends and supporters of this hospital. Gary's a member of our foundation board of trustees, and Kim has been an advisory member on our governing board as long as I have known her. Both are the most giving people and committed to this community. Kim and Gary, I think that you have something that you wanted to share tonight with Dr. Powell.
We would like to present a check to the Excelsior Springs Healthcare Foundation for $3,300.
Wow.
Ooh.
Fantastic.
Yes.
That is so
That's
lovely.
amazing.
We are
Thank you
so
much.
blessed to live in a community that promotes a healthy lifestyle, and this hospital is a cornerstone of that, and we like being a part of it.
That's
you.
great. Thank you
Okay.
so much.
Thanks for
Kim and
joining.
Gary, thank you for your ongoing commitment to our hospital in this city. What a wonderful gift to receive tonight on the best night of the year. Thank you.
You're welcome.
Thank you both. Thank you.
Now, the moment you've all been waiting for, our
Finally.
golden ticket drawing.
We're going to add back in all of those golden tickets that were purchased. Chris has them in her hands right now. We need to stir those up. I'm sure all of those names are in our final drawing tonight. Got it? All right.
Okay.
And don't go too far, Chris.
Yeah, don't go too far away. And to do the honor, we all agree that this honor should go to a person who deserves to be recognized tonight. So, Chris Riegel, the administrative coordinator and foundation director, this thing wouldn't happen without Chris. She's worked tirelessly to make tonight go through. So,
Countless
thank you so
hours.
much, Chris.
Thank you, Chris, for all the temper tantrums, all the work behind us,
Yeah.
all the auction items. Thank you so much, Chris.
That's amazing.
So please draw my name.
Brent Fielder.
Woohoo!
Great.
Very
There you go.
nice.
Thank
Yay,
you, Chris.
Lisa and Brent, having a good night tonight. How awesome is that?
Okay, I guess we're done.
Right there.
Okay, that's
We're
all for us
done.
tonight. I also particularly want to thank Jason Cole and Courtney Cole for all the work they put in, and every video you saw tonight they were involved in, and the editing and producing tonight's event, and that's just, none of this would happen without them and Morgan Sites, and we appreciate their support.
Absolutely. Thank you.
So thanks for tuning in. Special thanks to all those who participated in tonight's event. Another special thanks to our sponsors.
Absolutely. Have a good night. The auction is still live for another 11 minutes, so get your final bids in, guys. And thank you so much for your support of the hospital. It's been a great year. We couldn't do it without you. God bless. Have a good night.
Thank you.